In today's show, we're going to optimize your sleep. We're going to draw upon 8 recently published studies that will help you better understand why your sleep quality and sleep duration may not be optimal. And I was inspired to create this podcast after a consult with a client who had reported that she was getting up in the middle of the night to go to the bathroom. Now, she thought it might be the result of taking a calming, relaxing, sleep-promoting supplement and drinking too much water before bedtime. But it was just 6 ounces of water about 90 minutes before bed, and that to me was not sufficient to reflect why she was getting up every night to go to the bathroom. So I probed a little bit further, and it turned out this individual had sleep disorder breathing. She would wake up with a dry mouth. She was admittedly a mouth breather. So we started to talk about tips to enhance her ability to breathe through her nose, which can help with her sleep duration as well as sleep quality, because she was unaware of the fact that the symptom of getting up to go and urinate in the middle of the night is actually a reflection of sleep disordered breathing. So if you are trying to optimize your sleep and you're getting up to go to the bathroom, it may not be because you're drinking too many fluids before bed. It could be because you're breathing improperly while you sleep. So this is going to be the first part of this conversation. Then we're going to talk about circadian rhythm and light optimization, and then dovetail that all in with solutions to help optimize your sleep and focus on entraining your body and relearning how to breathe properly through your nose when you're sleeping. And I have some tools and tips that I'm going to share with you shortly, like 3M micropore tape, in addition to other things that I think will benefit you. So again, this conversation was inspired through a client call. This individual is in her early 50s, recently went through menopause. She's on progesterone. That was one of my first questions that I asked her, because when women go through menopause, there's an obvious shift in their hormones. And when progesterone is low, that can really compromise sleep quality and sleep duration. Now, thankfully, she's taking oral progesterone, because oral progesterone, as you likely know, is really important for women because it's converted to allopregnenolone, which helps foster deep sleep. So she's working with a bioidentical hormone specialist who is optimizing her hormones, which is great. We're working on exercise and circadian rhythm optimization, which I'll talk about shortly. But in my opinion, one of the biggest factors that is compromising her sleep quality was sleep disordered breathing, and this was causing her to wake up and urinate. It turns out that there's a 20-year dossier of literature finding the connection between sleep disordered breathing and frequent nighttime urination. Here's one of many studies. This study that I shared with this individual is titled Sleep Disordered Breathing and Nocturnal Polyurea. Polyurea is the medical characterization of frequent night urination. And this article and many others talk about how when individuals have sleep disordered breathing or obstructive sleep apnea, the changes in the pressure, intrathoracic pressure, as well as the apneic events increase the natriuresis in the body, which causes you to urinate. And there's a release of atrial natriuretic peptide due to cardiac distension. And this is, again, caused by the negative pressure environment from having these apneic events. When you're breathing through your mouth, oftentimes the tongue collapses on the airway and causes problems. And this cardiac hormone increases sodium and water excretion and also inhibits other hormone systems that regulate fluid volume, such as vasopressin and angiotensin receptor aldosterone complexes. So treatment of sleep apnea and airway compromises have been shown to reverse nocturnal polyurea and thereby reduce or eliminate the frequent urination in the evening time. So again, a symptom of sleep disordered breathing is waking up to urinate. We often hear that men, they have enlarged prostates and so forth, and that's the reason why they're getting up to urinate. And we often hear about overactive bladder syndrome as just a consequence of, say, having children or getting older. But it turns out that overactive bladder syndrome, particularly in women, there's a high correlation with obstructive sleep apnea as well as sleep disordered breathing. So if you are an individual who has an overactive bladder, you might want to consider getting a sleep study, or on the bare minimum, start with mouth taping during the day and then possibly during sleep as well. Of course, work with a healthcare practitioner and make sure that you're not drinking before doing this, or things like that, because that can be very problematic. But we have many other videos that talk about mouth tape, and I'll share with you exact solutions and protocols towards the end of this video. But there's a large, again, dossier of literature correlating overactive bladder syndrome in women with sleep apnea as well as sleep disordered breathing. This paper, published in 2008 in the American Journal of Obstetrics and Gynecology, highlights just that finding, that In 81% of subjects who have overactive bladder syndrome, they also had obstructive sleep apnea. So this is really important to understand this. And they also found an inverse correlation with REM, that is rapid eye movement, and chronic overactive bladder syndrome. Meaning, so if you're not getting good quality sleep and REM sleep, and that's where memory consolidation occurs and dreaming occurs, you're more likely to have symptoms of an overactive bladder. And in fact, that was the case for this individual. So all the magnesium and L-theanine and GABA and glycine, all those health promoting supplements that we often recommend and we get good results with, those aren't sufficient to overcome sleep disordered breathing and sleep apnea. So that's really important to acknowledge that if you're struggling with sleep, which is very complex, you first need to address the foundation and the basics. Now, it's important to acknowledge this research is not specific to women. Here was an article published in the Journal of Urology in 2015 highlighting that sleep disordered breathing in male veterans was also linked with frequent night urination, which is a problem. So as you can see here from figure 3, we're going to focus on this and then talk about how to resolve this very common issue of sleep disordered breathing. As you can see here in part A, when you're properly nasal breathing while you're sleeping, your airway is open. Your tongue is not blocking the airway. But as you can see in part B, C, and D of figure 3 from the paper that I will highlight here shortly, the tongue collapses on the airway tube if you are mouth breathing, and that is causing a lot of stress on the heart. We know that sleep disordered breathing as well as sleep apnea is linked with cardiovascular disease and death from cardiovascular disease, a whole litany of problems, even obesity and diabetes. So this is really, really important. And I'll share with you some of the symptoms as well as the underlying causes of sleep disordered breathing shortly. But I wanted to paint this visual so you have a good idea here. If you are mouth breathing, your tongue is going to collapse your airway and you are going to suffer from apneic events, and you are going to be starved of oxygen and not have good quality sleep and have a litany of downstream challenges, which is problematic. So again, to summarize, the symptoms here of sleep disordered breathing are frequent night urination, waking up with a dry mouth, snoring, as well as having unrestful sleep. A lot of people get 8-9 hours of sleep and they feel still exhausted. There's other non-specific symptoms such as high blood pressure, such as obesity, such as insulin resistance. But again, waking up with a dry mouth, snoring, or even mouth kind of popping. So you might notice your partner or child or someone you know puffing like that. That is another symptom of sleep disordered breathing. So if you personally or know someone that does that, you want to keep watching because we're going to talk about the solutions. But first, friends, I hope you're enjoying this video. And if you're enjoying this content, please hit that like button. I appreciate your subscriptions. I read all your comments, try to reply as many as possible. And I want to thank this video show sponsor, bondcharge.com, the makers of a range of health promoting tools, including my new personal favorite, the red light face mask. This mask is the ultimate way to achieve younger looking skin, reducing fine wrinkles, as well as lines, and even out the skin tone and get your confidence back with youthful, glowing skin. Just 10 minutes a day is all you need. This cordless mask is equipped with the most optimal wavelengths of red and near infrared light. I've been using this for the past 90 days, friends. I really like this. I do this first thing in the morning when I'm out doing my routine because I can tuck in the battery right in my pocket of my shorts. It's an amazing tool. I think it's a great way to just optimize the health of your skin. So you can save by going to bondcharge.com/HIH, and I'll put links in the description below as well. So going back to sleep disordered breathing, again, this is a highly under-recognized but really important lever that you can improve in terms of optimizing your quality of life. This is really, really important, my friends. And I'm so passionate about this and share this with my clients because this has changed my life. I want to thank Dr. Mark Brahenna, a dentist, a sleep specialist. He doesn't practice anymore, but he does have a great toothpaste now that I will link in the description below. It has hydroxyapatite and other great health promoting ingredients in there that support the health of your oral microbiome. It's called FIG. Again, I'll put that in the description below. I'm not being paid to say anything about that, but a great person, great friend, and a great product. And he introduced me to this concept of sleep disordered breathing. At first, I thought it was a joke when he was saying that at night, he tapes his mouth shut. And since then, I've produced many videos because it's really improved my life. I went out and bought this 3M micropore tape. I've been using this for almost 10 years now. If you're watching on YouTube, it's very simple. You just take about 2.5, 3 inches, put it across your lips like that. I kid you not, I woke up the next morning and felt like a new person. I had been mouth breathing my entire life. And no one told me about this. Not that I had high blood pressure or obesity or metabolic syndrome, but I just felt tired, particularly as a child in school. And so I immediately noticed the symptoms of sleep disorder breathing after diving into the research, got my daughter on this, got her on a Myo brace, and it has changed the shape of her face and her jaw and her teeth. I mean, this, I think, is a really piece of low-hanging fruit that not enough people pay attention to. We talk about vegan diets or carnivore diets. We talk about exercise. All those things are great, but look, if you're breathing improperly while you're sleeping, that's a major problem. And so I want to share with you this article that was published, again, almost 20, well, this was in 2013. It has since been cited 5,000 times. And this was published in the American Journal of Epidemiology. The title is Increased Prevalence of Sleep Disorder Breathing in Adults. And so again, we want to think about pathology on a spectrum, right? You don't go from normal glycemic to full-blown insulin-dependent type 2 diabetic. You go through the process of being insulin-resistant, pre-diabetic, and then you get diabetic. Now, in this analogy that I'm trying to paint the picture for you here, sleep apnea exists on a spectrum. You don't go from normal nasal breathing to sleep apnea overnight. You start to have sleep disorder breathing where you might have the popping, you might have snoring, you might wake up with a dry mouth, you might wake up having frequent urination at night and things like that. So the prevalence of this is increasing, probably because of antibiotic use, not being breastfed, not fully latching onto the nipple, because as you can imagine, if you've had a child yourself or witnessed a child breastfeeding on a mother's breast, they're fully latched. The mouth is fully latched on the nipple, and that child is forced to breathe through its nose. But because we're giving these infants antibiotics oftentimes because of they're birthed via C-section rates, it's like 1 in 2 kids now are born via C-section, so their microbiome is off. We're not giving them good nutrition. A lot of children are now being fed formula, and that's soy protein. It's not the same as mother's milk. So the vitamin D, the vitamin K, the fat-soluble vitamins, vitamin A, not going to be there. And so there's the structural aspect of having a smaller airway, and then also being exposed to ultra-processed foods and foods that don't require chewing, some of the grains and so forth that many kids are eating now. About 65% of the calories that kids eat is coming from ultra-processed junk food. So we are seeing an increase in sleep disorder breathing and the downstream consequences. As I've shared with you before, 9.4 in 10 U.S. adults is on the spectrum of metabolic syndrome, has some metabolic challenge, whether it's insulin resistance or increased visceral fat and beyond. So we're seeing all these diseases increase, and we can blame the food and lack of exercise, of course, but we also need to look at how people are sleeping and breathing while they're sleeping. And so I think that's why this paper was cited 5,000 times. And it turns out that there are substantial and harmful consequences to your health if you are not breathing properly while you sleep. And the immediate effects include intermittent hypoxia, fragmented sleep, and exaggerated fluctuations in heart rhythm, blood pressure, and intrathoracic pressure. In turn, these acute physiological disruptions evolve into long-term sequelae, such as hypertension and cardiovascular comorbidities, decrements in cognitive function, mood and quality of life, as well as premature death. We have another video coming out shortly about the rise in premature death among young people. Why are young people dying from all different causes? Why is cancer on the rise? What about sudden cardiac death and stroke? All these conditions are on the rise. They can be traced back, of course, to the food and the lifestyle, but also sleep disorder breathing. So again, I get very passionate about this because the fixes, in my opinion, are so simple. I spend about $11 a month on 3M MicroPore tape, and it dramatically improves my life. And I hope that after watching this video, you can implement this, and it will probably improve your life as well. Okay, so another symptom that I mentioned is mouth puffing. People do that all the time if they have sleep disorder breathing. Here is a paper from Nature and Science of Sleep. The title is Mouth Puffing Phenomenon and Upper Airway Features May Be Used to Predict the Severity of Obstructive Sleep Apnea. So some of the symptoms of sleep disorder breathing are loud snoring, gasping during sleep, obesity, and enlarged neck circumference. These are risk factors for both sleep disorder breathing as well as obstructive sleep apnea. The exact prevalence is unknown, but the estimates tend to be between 2 and 14% in terms of the adults here in the US that have obstructive sleep apnea. So about 1 in 10. And the prevalence of sleep disorder breathing is about double that. But these are relatively old statistics. I think it's probably more like 1 in 3, 1 in 4. And so we know that there are all sorts of challenges here. And here's a great article of the decision tree and the pathophysiology of sleep disorder breathing and obstructive sleep apnea. So as you can see here on the left, adequate nasal activity, right? When lips are sealed and you're breathing through your nose because you're a nose breather, amazing, great stuff, no problems. As you can see here, no issues with changes in the physiology, the vasopressin, the anti-natriuretic hormone and all that. But as you can see here, when the lips are unsealed, and this is the red, right? You can start here. The blockage of the airway ensues when you are not breathing through your nose and you're breathing through your mouth. And so you can start to see the pathophysiology here where the tongue collapses on the airway. And this causes these apneic events, which are problematic, especially for the heart. And because heart disease, cardiovascular disease, is the leading cause of mortality here in the US and North America and throughout the world, you should pay attention to this. So you want to be breathing through your nose when you're sleeping. All the magnesium in the world and the vitamin D and the L-theanine and the GABA, all that stuff is great. It can have a huge effect on your mind and help you be in a calm state before bed. But if you're breathing through your mouth and your tongue is collapsing your airway, the magnesium and all that's not really going to help that situation. And so we're going back to figure 3 that I shared with you a few moments ago. You want to be like part A here. And this is where lips are sealed and you're breathing through your nose. And you can see the airway, the arrow is pointing towards the airway here. And it's wide open. You're not suffocating while you're sleeping. But in contrast, if your mouth is open and your tongue is collapsing your airway, you're having apneic events, which have a litany of downstream consequences, the least of which I think is just poor sleep. But the most serious is sudden cardiac death and increased all-cause mortality, fatty liver disease, obesity. I mean, it's all interconnected. So the way that we prevent this in the short term is just to use simple tools like this. But if you have full-blown sleep apnea, you might need a CPAP and a sleep study. So important stuff. It turns out that, mouth tape and these things, there's research showing they're effective. And here's one article titled "The Mechanics of Mouth Breathing and Its Role in Nasal and Sleep Disorders." And they talk about how using things like mouth tape and different appliances can actually foster nasal breathing. So again, this is a hack, but there is good research actually showing that it actually works. And one risk factor is obesity. And we're going back to that article that was cited 5,000 times, published in 2013, titled "Increased Prevalence of Sleep Disorder Breathing in Adults." As you can see here from table 4, it's quite obvious. It makes a lot of sense just from a sheer mechanical aspect of this. The more weight you're carrying in your upper body and the bigger the girth of your neck is, the more likely you will have sleep disorder breathing and mouth breathing. And so you can see the prevalence here in men who have a BMI greater than 40%, so severe obesity, it's 52%. Right? So it makes sense. The more girth you carry, and honestly, guys who work out, this goes for, if you have a lot of muscle mass because you work out, that's great, but you might be at higher risk of having sleep apnea. And many bodybuilders, they have a CPAP. Powerlifters, they have a CPAP. Because they just have a lot of mass there, and that's affecting their airway. And so, of course, if you don't use your CPAP and you have a lot of mass and sleep apnea, your recovery from exercise is going to be garbage. So important to focus on, obviously, losing weight is a good modality. Not all the world's problems can be solved with mouth tape. We need to also focus on the lifestyle things that we've talked about on these podcasts before. But I think it's important to acknowledge that there's this triad here with obesity, sleep apnea, and diabetes, as well as fatty liver disease. This is all interconnected, as you can see from figure 1. So sleep disorder breathing is part of the web. It's a spider web. And if one aspect of the web is being pulled in one direction, i.e. you're breathing through your mouth while you're sleeping and having sleep apnea, the other parts of the web are going to be affected. And that means that you're going to be at higher risk of having diabetes, weight gain, as well as fatty liver disease and cardiovascular disease. And so this is important that we address this. Now, what I think is interesting, and we're going to talk about really practical solutions momentarily, is the connection with leptin. And so we know that when we gain body fat, we start to release more leptin, and there's this hypothalamic resistance to leptin in the brain. And it turns out that also affects airway function as well as breathing rate and breathing capacity. And so it might be like a snowball rolling downhill where you start to gain a little bit more weight. You become a little bit leptin resistant, and you start overeating food because your satiety mechanisms are screwed up. So you gain even more weight, and that affects the mechanics of your breathing, but also that leptin resistance will affect breathing rate and this whole process. And so there was a recent report, so I just wanted to share with you, titled "Leptin Signaling in the Dorsomedial Hypothalamus Couples Breathing and Metabolism in Obesity." So interesting research showing that high leptin levels were linked with sleep apnea as well as sleep disorder breathing. And I've been sharing with you guys, if you've been following this channel for a while, this research since 2018. So this has been going on, this connection between leptin and sleep disorder breathing for at least 6 years. We've known about this. So it's just one more mechanism. So it's all connected. So again, if you have a little bit of extra body fat and you're trying to lose it, know that you might also need to focus on your sleep quality as well as how you breathe while you're sleeping. So where does that lead us? I want to get back to light as we talk about the light, because light is really important, but we're going to talk about mouth tape. So this is the product. I've tried to be able to resell this stuff. I mean, I don't know how much 3M micropore tape I've sold. I mean, if I could get a nickel for every one I've sold, I probably wouldn't have to make these videos anymore. But I just love this product. I've reached out to 3M. They don't get back to me. Anyway, I like this one. This is for sensitive skin. I'm sure the adhesive is probably not the best for you. There could be endocrine. I don't know. I'm not involved in the manufacturing of this, but in my opinion, focusing on preventing mouth breathing is more important than possibly the endocrine disrupting chemicals in the adhesive here. I haven't experienced any health effects that I know of from using this, only benefits. So you put a little bit on during the day while you're at your office. If you catch yourself breathing through your mouth, you want to entrain your neurologic system, just like when you're doing a new exercise. You want to practice this. It's a new way of being, if you will, breathing through your nose. And so start this during the day. Some myofunctional therapists will recommend putting a pen like this in your mouth. And so that will just train your lips to be closed and to breathe through your nose. So you don't have to use adhesive tape during the day, but this is important. Tongue position on your mouth, you want it right here. And your palate, the roof of your mouth, that's where your tongue should naturally go. And if you're doing this while you're sleeping, you should be breathing through your nose, which is great. Now, some people have a deviated septum. Some people can't breathe through their nose because they have allergies. And that is a symptom of a bigger problem. So if you can't breathe through your nose during the day, what do you think's happening while you're sleeping? You're getting terrible sleep. And so this is a symptom that you should work on fixing. It could be food allergens. It could be mold in the home. It could be other factors that you really need to address. And so I found that when I was drinking alcohol, I've been, haven't had a drink for 500 some odd days, red wine would clog my nose. And so I would wake up really tired and I thought, oh, it was the wine, but it's really the sulfates or something else in the wine that was causing me to be symptomatic, that was affecting my sleep. So important to consider, if you can't breathe through your nose, dig deeper. Don't just brush this off. That is a symptom that is reflecting ill health that you really need to address. So that's important, as well as monitoring your urination at night. Could it be that you're drinking too much before bed, too much water, too many liquids, too much food? Possibly, but it could also be that the sleep disorder breathing is contributing to this nocturnal urination, which is a symptom of poor sleep quality and duration. Now, let's finish up on sleep hygiene and light. This is another thing I think a lot of people just gloss over and think it's not that relevant. We talked about this about 2 years ago. The title of this post was Light Hygiene Science and Tips for Better Memory, Fat Loss, and Sleep. So I think that's important. And we talked about a recently published consensus panel that suggested that daytime exposure, and I recommend this I tell all my clients to go out on Amazon, get a photometer. It's $29. These are really easy devices that can test your light exposure. So during the day, you need to get at least 250 lux at all time, like all throughout the day. Like in the morning, go out and just walk outside. Even on a cloudy day, I've used my photometer. It's like 1,200 lux. On a nice sunny day, it's like 5,000, depending upon where you are. So you need a minimum of 250 lux. And so going back to my client, she was like, well, in the morning, I just, I get up, I check my phone, go to the bathroom, wash myself, and then I go to work, and I really don't see the sun, until my lunch break. And so that was another thing that I said, well, you know what? The the sun exposure in the morning and daylight exposure will help with sleep pressure later in the day, as will exercise. So I created this analogy, and maybe it'll resonate with you. If you think about exercise, the more exercise you do during the day, the more of a buffer you have against poor dietary choices, right? If you were to walk 50,000 steps, you could probably eat an ice cream cone and not suffer any ill consequences. Your glucose isn't going to change. You're not going to gain fat because you've walked so much. We're not suggesting that you eat ice cream cones every day or try to outwalk a bad diet, but just hear me out. Similarly, if you're on screens at night, but you've been in the sun all day, that pressure and the optimization from the light exposure will help to safeguard against screen use in the evening. Now, some of us use our phones for alarm clocks, or we have to check our phone to check in with spouses or family members or children or whatever before bed. I strongly suggest that you minimize your light exposure to less than 10 lux in the 3 hours before bedtime. And this is, again, evidence from the experts on this consensus panel that talked all about circadian rhythm optimization. So less than 10 lux. Your iPhone, if you don't change the filters on it, is putting out more than 30 lux. So if you're looking at your iPhone before bed, that is exceeding the expert consensus panel recommendations for light exposure. And that could be impacting and suppressing melatonin release. And so again, sleep gets complicated, but there's all these things fighting against quality sleep. And that's why we're making this longer video to help you better understand this. So, use blue light filtering glasses, change the settings on your phone. I've have videos that I can share with you in the cards section that will help give you tips on how to do that. And your bedroom should be very dark, less than 1 lux. If you have a TV in your bedroom, if you have your computer in the bedroom, or watch videos on your phone, that will compromise your sleep, which will compromise your body composition, which will affect your metabolic health. It's not a matter of if, it's when. And so I think it's really important, if you care about your long-term health, which I think you should, and that's why you're watching and listening, that you take this seriously and get the lights out of your bedroom. Even a small smoke detector light, an air conditioning unit, things like that. Tape those, paint those, cover them the best you can, get blackout blinds. These things, my friends, really matter. And so it's really, really important. So in conclusion, I'll put links in the description below. Definitely check out today's show sponsor, Bond Charge. Their red light face mask is phenomenal, as well as the 3M micropore tape and also a photometer that I've used. It's okay. I'll put it in the description below. I've heard there are apps on your phone, and make sure that you're getting plenty of light in the morning. This can really improve your sleep. So sorry for the long video, but hopefully you found these tips helpful. If you did, please hit that like button. Thank you for sharing this video. I would love to know how these tips improve your health in the comment section below, and we'll catch you on a future one down the road.